Assalamualaikum and hi everyone! This is a video that explains about sensory compensation techniques. So, let's explore it together.
Sensory compensatory techniques is a treatment for the patient that diminish or loss of protective sensation by compensating the body part that loss of sensation by relying on other senses. This treatment includes teaching patient, carer or caregiver the precaution and adaptive technique to prevent injury to body parts with the compromised protective sensation. Patient will use compensation techniques according to the extent of their injury, and the use of the uninjured arm is important in this process.
The purpose of intervention is to enhance a behavior to adapt to the environment, to facilitate basic physical functions, to improve occupational performance, to reduce pain at affected hand, to restore body awareness associated with hand movements. Moving on to compensatory theory, utilizing to use an assistive device to compensate for malfunction in desired occupations. Additionally, it is based on the notion that the dysfunction is largely irreversible. At first, the compensatory technique could be tough for the clients to embrace because they might think of their missing functions. In conjunction with this theory, an educational approach is used to clarify the goal, purpose, and explain all risks and precautions to the clients. Furthermore, task modifications also can be used to adjust the task to make up for the functional loss in order to increase independence. Hence, in order to maximize independence within the limitation of disability, it becomes necessary to compensate for severe impairment.
Here are the procedure preparation. Firstly, the therapist will interview and assess the patient to determine the type and extent of sensory impairment. The intervention or treatment will be provided based on the patient's needs, abilities, and goals. Let's say if the sensory is totally lost, the therapist may educate the compensation techniques to the patient. Therapist will explain the purpose of intervention to the patient. The most important is therapists need to take the precautions to prevent injury. By using compensation techniques, patient can use their less affected part. According to Brand in 1979, it can help to avoid exposing the affected area to heat, cold or sharp objects. And then, patient may use their unaffected side to check the temperature before bathing or washing objects. Patient may also use their unaffected side to handle sharp objects. Lastly, they can use their unaffected side to perform household management tasks such as cooking, eating, and ironing.
Use of adapted devices allows individuals to hold a lot of things with minimal effort and distribute the pressure evenly. It is important to be mindful of grip force. Avoid applying more force than necessary when gripping a tool. Smaller handles have a less distribution of pressure over the gripping surfaces, leading to increased strain on the hand. It is best to avoid them. Observing the skin for signs of stress such as redness, edema, and warmth is crucial. It helps in identifying any potential issues and taking timely actions. Tasks that demand the use of single instrument for extended periods can be challenging, especially if the hand is unable to adapt by changing its grip. Changing tools frequently at work allows the tissue to rest, reducing the risk of overluxations and discomfort. Adapted devices play a vital role for individuals with severe breakup surgery, such as a bedside beverage holder becomes an ideal companion. Another valuable adaptation is the sock slider that enables patients to effortlessly slide their feet into the socks without excessive bending or straining. Pull-up handles offer enhanced functionality and ease of use. They provide a larger grip surface, distributing pressure and reducing strain on the hand. Here are the examples of adapted devices that can be used for sensory compensatory interventions. Utilizing other senses, especially vision, helps in observing the movement and positioning of body parts as well as monitoring the skin's conditions. If blister, laceration, and other wounds develop, it is crucial to handle them with extreme caution to prevent further harm and infections. Following a regular skincare routine is important for maintaining smooth and plain skin. Soaking and oil massage helps lock in moisture, promoting skin health. After completing sensory compensation techniques, patients return to their therapist for follow-up assessment to record and maintain progress, ensuring continued support on the journey to recovery.
So, what is the evidence base of sensory compensation technique? According to Radomski and Ledem 2014, therapists can educate patient or caregiver about sensory compensation technique if the patient had loss or diminished of sensation. But there are no research studies that confirm about effectiveness of sensory compensation technique to prevent injury. There is an article about compensation by the uninjured arm after brachial plexus injury. According to Munkyuso et al. 2016, patients with brachial plexus injury who use small uninjured hand can fulfill basic physical function.
That's all from us. Thank you for watching.